take a look at all the possible blood types and see which donations are safe for each one. When you consider the four main blood types, A, B, AB, and O, and the fact that each of these can be either Rh positive or Rh negative, you end up with 8 possible human blood types: A positive, A negative, B positive, B negative, AB positive, AB negative, O positive, and O negative. Let's look at those in a chart. Let's start with A positive and see who this patient can receive a donation from. An A positive patient can receive blood from an A positive donor and an A negative donor. They can also receive blood from O positive and O negative donors. However, they cannot receive blood from any type B donor, whether positive or negative, because a patient with type A blood has anti-B antibodies that would react with the B antigen. Similarly, an A positive patient cannot receive blood from an AB donor, either positive or negative, for the same reason. The presence of the B antigen would trigger a reaction. Now let's take a look at an A negative patient and see which blood types are safe for them to receive. Since this patient is A negative, their red blood cells have the A antigen but do not have the Rh antigen. That means they can safely receive blood from an A negative donor, no problem there. They can also receive blood from an O negative donor, since O negative blood has neither A, B, nor Rh antigens. So there's nothing foreign for the patient's immune system to react to. However, an A negative patient cannot receive blood from any donor that is Rh positive, even if it's A positive or O positive, because their immune system could recognize the Rh antigen as foreign and mount a reaction. And just like before, they can't receive blood from any type B or AB donor, whether positive or negative, because of the presence of the B antigen, which would react with their anti-B antibodies. So, to sum up, an A negative patient can receive blood from A negative and O negative donors only. Any blood with B antigens or the Rh antigen is off limits for this patient. Now let's look at a B positive patient. This patient has B antigens and the Rh antigen on their red blood cells. They can safely receive blood from B positive and B negative donors, as well as from O positive and O negative donors. They cannot receive blood from any A or AB donors, whether positive or negative, because their anti-A antibodies would react with the A antigen. So, for B positive patients, stick with B or O blood types, and either Rh positive or negative is fine. Now let's talk about a B negative patient. This patient has B antigens on their red blood cells, but no Rh antigen. They can receive blood from B negative and O negative donors only. Any blood with the A antigen or the Rh antigen. So AAB or any Rh positive type is off limits because their immune system would see those as foreign and react. So for B negative patients, it's just B negative and O negative on the safe list. Let's move on to an AB positive patient. This is the easiest one. AB positive is known as the universal recipient for red blood cell transfusions. That's because these patients have both A and B antigens, plus the Rh antigen on their red blood cells. Their immune system won't see any of the ABO or Rh antigens as foreign, so they can safely receive blood from any type, A, B, AB, or O, whether it's Rh positive or negative. In other words, if you're AB positive, you can receive red blood cells from any donor. Now, for an AB negative patient, they have both A and B antigens, but no Rh antigen. This means they can receive blood from AB negative, A negative, B negative, and O negative donors. They can't receive any Rh positive blood because their immune system could react to the Rh antigen. But since they have both A and B antigens, they don't have anti-A or anti-B antibodies, so those antigens aren't a problem. For AB negative patients, any blood type that's negative for the Rh antigen is safe, as long as it doesn't introduce any new antigens. Now let's look at an O positive patient. O positive is the most common blood type, and these patients have the Rh antigen but no A or B antigens on their red blood cells. They can receive blood from O positive and O negative donors only. They can't receive blood from any A, B, or AB donors because those would introduce new antigens their immune system would recognize as foreign. So for O positive patients, it's just O positive and O negative on the safe list. Finally, we have O negative patients. This is the universal donor type for red blood cells, but when it comes to receiving blood, O-negative patients have the most limited options. They have no AB or Rh antigens on their red blood cells, so their immune system will react to any of those antigens if introduced. That means O-negative patients can only receive blood from other O-negative donors, no exceptions.